I'm in the Philippines as the Assistant Administrator for USAID, where I oversee our global health work. Philippines is one of our most important partners for, and has been for decades, in our work to advance health and stop disease from spreading in the Philippines, in the region, and around the world. It's also very personal for me. Secretary Herbosa and I have partnered together as both surgeons for now almost 20 years. I was leading work for the World Health Organization 20 years ago to make surgery safer. And Ted Herbosa was a vital leader who became a partner in this work and a friend. Together we ran a WHO safe surgery checklist trial, testing at Philippine General Hospital and in 7 other cities around the world, a 2-minute checklist for safer conduct of surgery. It ended up cutting the death rate 47% in cities ranging from not just Manila, but London to Delhi. And we found that as surgeons, we could change care across the world and save millions of lives. That work is now the standard of care in operating rooms around the world. I saw Ted Herbosa become the Undersecretary of Health and demonstrate ways that a surgeon can contribute to the health of an entire country. And I also followed that pathway and leading global health for USAID, where we support billions in investment to enable more than 60 countries around the world to achieve better results and improve health security. Our work here in the Philippines is very broad, but the fundamental work that brings me here today is the joint partnership with the Philippine Department of Health to reorient the health system towards primary health care. Secretary Herbosa has recognized what we have recognized. Philippines is well on its way to being a upper middle income country, but the results of health in the country are not that of an upper middle income country. Life expectancy here is a decade shorter than it should be. Only around 70 years of life. Most of the risk is that it's children and young people who are dying in numbers that are completely avoidable. It's conditions like TB and HIV. It's missed immunizations. It's lack of family planning. It's mental health needs. We have partnered to enable that work, but I've also made Philippines one of 7 primary impact countries that were chosen as countries where we would, as the United States, focus on support to strengthen primary healthcare systems and demonstrate to the world how those stronger systems can achieve higher life expectancy across the life course, maintain and succeed in achieving results with manageable cost and making it happen at large scale. The Philippines is committed to that work and making enormous strides that are coming into place, and our chance to meet together as a chance to do planning around making that happen. Finally, I'll say we got to participate this morning in a celebration of the conclusion of another 5-year phase of our work. There was a 2018 to 2023 plan of investments across TB, HIV, community-based drug rehabilitation, ended up involving COVID, and we have our long-standing work in pandemic prevention and response that played an important part in that COVID operation. And today we celebrated the conclusion of yet another phase of this work. We have worked together for decades. We will work together for decades more, and we're looking forward to the next 5-year phase of our partnership together. So with that, I'll just say Philippines is our best demonstration that we can do great things. And how do we know? Because we have done great things for health for Filipinos.
You mentioned that the Philippines is among the 7 focus countries for the primary impact program. Just wanted to know what were the criteria for these countries, and how did the Philippines fall into this criteria?
Well, WHO announced as a major priority of the Director General, Tedros, that the radical reorientation of health systems towards primary care was the single most important thing that countries could do to improve their life expectancy, to improve the survival of their citizens. And we chose countries that would be making that commitment. There were 5 in Africa and 2 in Asia, Indonesia and Philippines. And one of the core things they all have in common was that they were increasing the percentage of their budget and investment that is going to the primary healthcare sector, not just to the hospitals where people come when they're already very sick, but investing in the community level primary healthcare and showing it with their budget and plans. That includes in the Philippines work negotiations currently underway with the World Bank, Asia Development Bank, for arriving at financial packages that will allow for major investments to upgrade the services at that community level. So these countries are demonstrating domestic commitment, national commitments to strengthening their primary healthcare system and showing what can be done, and we are strongly supportive and here to partner on that.
Good afternoon, sir. Sir, what do you think is the Philippines' chances in improving the primary health care of the Philippines with the current efforts that the country and the DOH is doing?
I had a chance to meet with the PhilHealth team this week, and the PhilHealth, is traditionally a insurance program, a universal health coverage program for hospital care, but it is making its commitment now with Consulta to have that primary health care financing. Only a portion of the Filipino population has been enrolled in the program, and there's still much to learn to make it successful at a broader scale. USAID is supporting that work as an example, providing technical assistance, being able to do analyses and offer information following the plans of what they require, whether it's to improve enrollment, to reduce barriers to physicians participating in the program, having more centers join so that it will be a highly successful program. That's an example of a strong program design that can become the foundation of a much better health and survival for people in the Philippines, but where there is still much work to be done to get it to be the place where it can serve that purpose.
Just a while ago, Secretary Ted Herbosa announced that he aims to bring primary health care to 28 million Filipinos by 2028. Is this an achievable goal? Is this realistic?
Very much, yes. So the plan that he has is for building that polyclinic level of a strong center for the 28 for 28 for 28, providing primary healthcare services in large centers that people can come to in the city centers in provinces. At the same time, there is the strengthening, and that part is highly achievable, and the financial plans are in development to begin to get to that place. And in fact, there is more that can be done. The strengthening of the rural health units is going to be critical, and those are spaces where we're partnering on working to enable the success of that whole primary health care plan, whether it's working with PhilHealth like we're doing to support their ability to improve the Consulta program, or in some of the highest burden regions, we're working to make the whole program and systems of care, whether it's training or electronic systems, support the ability to make that better.
Just one more question.
Sure.
You mentioned it in passing, but how can the Philippines make its medicines and hospitalization cheaper or even for free? A while ago, the Bureau of Internal Revenue announced that it will cap the value-added tax for 21 medicines for cancer, diabetes. So that's a good start, right? So how can we continue that?
Yeah, the challenge of the costs of tests, medicines, et cetera, are significant, and we've worked and demonstrated, for example, in TB, that we're able to lower the costs of medications and diagnostic testing. There's and I'm going to pull up to remember the name of the program here. In TB, it was the the Philippine Private Sector Diagnostics Consortium that was established in order to enable lower costs for testing. It cut the costs of testing for TB by 70% for private clinics to be able to get the tests that are needed. At USAID, we have partnered with Philippines and many other countries to enable a TB drug facility to buy drugs, and lowered the cost of TB drugs for drug-resistant TB by 55%, and for treatment for more drug-sensitive cases by 30%. And so there's a variety of ways that we have provided, either enabled procurement to lower the costs, worked with different components like PhilHealth on how they're paid for. So we think that there's many kinds of approaches and technical solutions that are contributing to ways to lower some of these costs.